general impression is.
What do you want to know about the general impression?
What's the age?
Approximately 70 years old.
What's the weight?
Approximately 180.
His level of distress.
It's moderate.
Are there any life-threatening?
There's no life threats. No current life threats.
And position found supine.
Supine on the ground.
Okay. I will approach the patient. Sir, okay. And then I will. Oh yeah, okay. Where are we, sir?
In my house.
Okay. What day is it?
It's Wednesday.
Okay. What were you doing to cause this?
Sure. I got up to get a glass of water and I fell.
Okay. What's your name?
John.
John. Now someone check on his vitals.
Sure. Yeah.
So what do you check his vitals?
Any other question?
Can you give us or there's no life-threatening.
No life threats.
Okay.
Yeah.
Check his ABCs.
Okay.
Is his airway open, clear, and maintainable?
Airways open, clear, maintainable. No need for suction or adjuncts.
Is his breathing? How's his rate, effort, depth, and oxygenation?
Your partner's got to put up SpO2 for me to do that one. But rate's going to be about 20 breaths per minute. Normal effort, normal depth. SpO2 reading's going to come back at 91% on room air. And anything else you want to check with breathing?
His effort, or
No,
his.
you said effort already.
I said depth too.
Mm-hmm.
His lung sounds. I will also take his lungs.
Okay, so you check his lung sounds, they're clear and equal bilateral.
Okay. And then now I will. My first transport decision.
Not yet. You did A, B, and we're about C.
Check his pulse, motor, and sensory skills. Can you check his pulse?
So you gotta check both.
Can you check both? Sorry.
No, you gotta check both. So you're just checking. You don't have to check them both at the same time. You're at this point you're just checking circulation. Right?
Okay.
So that's PMSCs. So we check it like that in PMSCs, but we're checking just circulation right now, right? So we're gonna check his pulse. What are we looking for?
Rate, rhythm, and quality.
Okay, so it's gonna be about 100 strong and regular.
Checking his capillary refill.
Cap refill's immediate.
Can you feel this when I?
So we're not checking PMSCs at this point.
Oh,
just,
we're not.
just circulation.
Oh,
Yeah.
okay.
So what else are we looking for under C?
Is his skin? What is?
Skin signs, right?
Yeah. Skin
What are we looking for in skin signs?
The color, the temperature, and the feeling.
Moisture.
Moisture.
Yep. So it's gonna be normal, a little clammy, and normal temperature.
Okay. And then first transport.
One more thing in C. this one's gonna be life-threatening hemorrhage, right?
Okay.
So life threats, the first one we say is just generalized, any kind of life threats. Like, is there a knife? Is there a gun? Is there, is there glass on the floor? Is there whatever it is. Is there bleeding? This one's specifically just bleeding.
Okay.
So life-threatening hemorrhage, you don't see any, so everything else checks out.
Okay. What's next?
So now it's your first try.
Okay. We'll stay because there's no life threats.
Okay.
Or no hemorrhage.
So your ABCs are compromised? What was that reading?
Oh, it's
What's your reading?
91. We'll give him oxygen.
Okay, who do you want to do that?
I'll have
What do you want to give him?
nasal can.
And how many?
2 to 2.
2 liters?
Yeah.
Okay, cool. Probably be in that green pouch. Alright, so first transport decision, what is it?
Would we go?
That's not the nasal cannula. You want the one that goes on the nose.
Would we go because he needs oxygen?
So once you put on the oxygen, you fix it. So
Okay.
Is
So
it-
stay.
Yeah. If you can find it.
It's the.
Yeah, it's not gonna be in there. So you have to look for it. You guys check out your bag.
Is it in the? It's on the side right there. On the. No.
Check out your bag. Okay. Let's say we have a pretend nasal cannula.
Okay.
Here's a stick.
And it's working.
Okay, it's working.
Yeah.
Now we will do his head to toes.
Okay. Yeah.
For the head, we're gonna check.
Get down there.
For the head, we're gonna check vital signs of raccoon eyes.
Okay. What else are we checking?
CSF.
Okay.
Cerebral spinal fluid.
What else?
Any deformities.
What's that umbrella term?
DK.
DKBLS safe, right?
Yeah.
And then we're also checking.
Any deformities, contusions.
No, we're good.
Oh.
You said DKBLS safe. We're gonna just use that.
Oh, okay.
And then facial asymmetry, right? And blood on gloves.
Okay.
So you're gonna run your fingers to a scalp. and you
Would
check-
I do that, or
Yeah,
would
you
you?
do it. Okay, it's clear.
Okay. No battle signs, no raccoon.
No,
eyes.
it's clear.
Now we're going to move down to the neck,
Okay.
or to the neck, and then no JVD,
So which side are you gonna check first?
the closest one.
Which side is this?
Oh, anterior,
Anterior side. Okay, so what are we checking in the anterior side?
jugular vein distension,
So JVD. Okay.
tracheal deviation,
Okay.
and stoma.
All right. 2 more.
Any trachea.
No, you said that one. What about? It looks like a necklace.
Oh, metals.
Medical alert test.
Oh, yeah, medical alert test.
And then what we say was Rice Krispies? Kind of like Rice Krispies.
It sounded like Rice Krispies.
Yeah, it feels like it. It sounds like it.
Probably. I don't know what that one is.
Subcutaneous emphysema, right?
Yeah.
And then obviously decap BLS too.
Okay. And then now we're going down to the chest,
Not yet.
the arm, the external,
Nope. Still on the neck. What side of the neck you have to check now?
the anterior or posterior.
Correct.
Any blood on gloves.
Sure.
Any spinal defects. Any other than am I gonna?
So decap BLS did great. Like we check on every body part.
Okay.
We're checking for spinal alignment, right? Spinal step up and spinal tenderness.
Is spinal step off? What?
Step off is like a step. So
Okay.
you feel like a dip inside.
Okay.
So when you palpate his neck, he does have spinal tenderness.
Okay. So then we would put a C collar on him because he could have hurt his spine.
Yeah.
You want to put on the C collar? Or can you
Can she let go see spine?
Oh no. That's the
So he could do that, right?
other one. Yeah. He
Okay. So keep moving.
can. And then now I will do the chest.
Yep.
I'll take off the clothes, and then I will check for deformities.
So you lift up the shirt?
DCAP, BTLS.
So looking for decap BLS, okay, right? What else are we looking for?
Any distension? Oh, that's abdomen.
That's afterward. Yep.
Flail chest. Asymmetric breathing.
Paradoxical movement.
Paradoxical. I don't know what's next.
So sucking chest wound, right? And that's it, I believe, right? And then one more thing that we're checking in the chest that we didn't check it during our ABCs. What's behind the chest wall?
What's behind the chest wall?
Yeah.
Diaphragm.
Lungs, right?
The lungs. Oh, breathing.
Lung sounds.
Oh, lungs.
Yep. And then do you remember how we palpate the chest?
Yeah.
That's the abdomen. So we're going to use anterior to posterior pressure, right? So you're going to use both hands. Palpate from the clavicle all the way down to the last rib. Cool, and then lateral to medial. Lateral to medial meaning from the side to the middle. So you're going to get under the armpits. And palpate like this. Lateral to medial. Yep. All right, the chest is clear.
Now we're going down to the abdomen.
Okay.
No distension.
What's that umbrella term?
Dr. Germ.
Okay, checking for Dr. Germ, right? And then how do we palpate the abdomen? Correct. Yeah, you just need to roll once in each quadrant, so just 4 times. Cool. All right, abdomen is clear.
Now to the pelvis.
Okay. All right, let's take a second real quick. So we put him in a C collar. What is that telling you already?
His spine is.
So are we going to do any other kind of splint?
Oh, it is.
What kind of splint are we going to use? You don't know? What's behind you?
Backward.
Picking your partner, will be doing something right
Yeah.
now?
We can put him on. Start putting him on the backward.
Not put him on yet, but you're prepared, right? Yeah, straps and everything. So your partners, so it's your job to keep your partners busy, right? So if you know, already put him on a C collar, well, if I put him on a C collar, that means I'm gonna have to use the backboard. So then you can have them prepare the backboard as well. That way, whenever you're done with your head to toe, you can just roll them back onto it.
Okay.
You don't have to waste any time. Okay, so after the abdomen, what are we checking? So stay there, just get the straps and put the straps on.
The pelvis. And then,
Do you remember how to prepare?
and then I need to
you remember how to prepare it, the backboard? Does anyone remember? Okay, we'll go over it right now. So you're checking the pelvis.
Okay, and then I'm going to check for decaf BLS, and then VIP.
Okay, cool. What do we need to do to be able to observe?
I will cover the patient and then
Take a look, right? Cool.
there's
It's good. How do we palpate the pelvis? Yep. Cool. There.
now we would we move on to the leg here? Sorry.
Like.
I'm gonna check decaf BTLS. I'm gonna offset pressure.
How's that offset pressure going to work with that joint right there?
Oh. How is it gonna work?
Separating the two, right?
Mm-hmm.
So do the top portion first.
Oh.
Yep.
And then would I
Other
go
side.
down?
No, the other side.
Do you do it from one side or do
You can still do it from the left side. It doesn't matter. All right. Now what decision do we make at this point?
the second transport decision?
Okay. What do you think?
Since there's possible spinal injury, transport.
You're loading go? Is spinal injury on our loading go criteria?
Oh no.
So have we found anything like an abnormal chest, abnormal abdomen, unstable pelvis, or bilateral finger fractures?
Just
Okay. So
just a.
have we met any criteria? No, right? So we're gonna say
Okay, and I'm done with
you're done with the upper part of the legs.
the. Okay. So now offset pressure.
What are we looking for?
Any DPLS.
Cool. All right. Now we'll move down to the feet. This is where you do your PMSEs.
Checking the fetal pulse. See it right here, like.
Yep. And then you're checking those bilaterally. All right, okay. Pulse is present.
Okay. Can you feel this stuff?
What do you want to ask?
Can you wiggle your toes?
Okay, she wiggles all, or he wiggles all 10 of his toes.
Okay. Would you still ask if they can feel it?
Yes, but what do you want to know specifically what they can feel?
Can you feel
So you're going to ask them what toe am I touching, right?
what toe am I touching?
Big toe.
Um,
Last step. Big circulation.
Oh, sensory. I did the pulse, I did the motor,
Yep.
I did the sensory.
Toes and fingers are capillaries, right? Legitimate capillaries. Cool. All right. Their whole PMSEs are attached.
Now I'm gonna do the arms.
Just like the legs, you gotta separate the two, right? Looking for what?
DPLS.
Cool. You check the top part, bottom. All right, that arm is clear.
Okay, now I'm going to check.
Not just yet. You're gonna check the other arm, right?
So like we just.
You can leave it good, but if you don't feel comfortable doing that, just move to the other side. That's fine too.
Now I'm going to check bilaterally,
Okay, pulse is present.
capillary refill.
Immediate on that right side. Immediate on the left.
I'm going to what finger is this?
The index
Can you wiggle your fingers?
wiggles in.
And then
No.
okay, cool. we set up the log roll, we're gonna check his spot.
Yep, so when you're preparing this backboard, we're gonna put these to the side. We're gonna get, this one you don't need to prep, you just need to prep the top strap, right? Yep. Yep, so we gotta go over right here, so we're gonna leave a little bit of slack, right? On this side, so you can go on that shoulder. And then this, we're gonna throw this hole right here. Because remember, we don't want it to go across his chest this way, because it's gonna be harder to undo, so we're gonna go through the back. So just prepare it like this.
Do you usually have it prepared like before you go?
Yeah, usually we'll have like, we have these buckles now that we use, but these are way more secure still. So sometimes you have time to prepare it before, most of the time you don't, so that's why you have, while they're doing their assessment, someone's preparing the backboard. Okay. So you just leave it like that. This one you don't need a prep, but you can tie it off right here if you want. All right, so you can bring the backboard, you guys can roll.
Okay. Excuse me.
Yep. So just line that up right there, or on whatever side. What side do you want to roll them on?
Let's roll them on.
Now, if he was injured on that arm, would you roll this way? So you go the other way, right?
Yeah.
Okay. But he's not, right? So it really doesn't matter which way you roll.
Yeah. And so we would need one more person, right?
Okay, sure. Fire shows up.
This one resource. And then we're gonna log roll on Faith's count.
Yeah. Remember how to log roll? Yep. What should we do with that arm before we roll? His right arm. Remember, just move it up. You want to get on his shoulder. Yeah. Okay. Okay, so decap BLS TIG. What else are we checking on the back?
And more step off.
Yep, step off, right? We're checking all the posterior neck injuries, right? So step off, spinal alignment, spinal tenderness. What else are we checking in the back?
Tenderness.
Yeah, but like, so we said the 3 S's, right? The ones we check in the posterior neck. So what we're checking in the back is all the posterior neck injuries. We're checking all the chest injuries and the pelvic injuries.
Okay.
So it's going to be a mix of all three together. So it's going to be decap BLS TIC, obviously. It's going to be spinal alignment, spinal tenderness, spinal step off. It's going to be flail chest, sucking chest wound, impaled objects, paradoxical movement, right? We would also check lung sounds as well back here. We're checking for VIP as well, and then we're checking for a walk.
Okay.
So the back is clear.
Now, we're gonna put them on the backboard now.
Yeah.
So, I think you need to.
Yeah, you can. You can do that.
And now we're going to adjust him on Faith's count.
So fire will leave now because you don't need him anymore.
Is it? It's like
Which depends which direction you
up
want to
and to the left,
go. Okay, so you're gonna go under his armpits and you're gonna go in the pelvis.
like that.
Yep, just like that.
Okay, on Faith's count.
set him on the side real quick?
We're gonna just move him down.
Can we move straight down?
No.
No, right? What's the one direction we can move straight now? Straight up, right? So now we're gonna have to choose a side to go to. If we're gonna move him down.
We'll go back to this side.
So if you're gonna move down, now you have to go above the shoulders. You still stay in the same position. So down into what?
Down into the left.
Okay.
1, 2, 3.
Which way did you just guys? Which way did you guys just move it?
Down.
And to the right.
Oh,
Because it's always the
yeah.
patient's right or left, right? So just keep that in mind. Okay. All right. Now does he look centered? Still?
Yes.
Kind of centered. Where would those straps end up?
The straps would end up. Oh,
Still on his eyes, right? So do we still need to move?
yeah. Up into the.
Well, you move down into the left, right? So now you go down into the right to kind of center him a little bit more and to get him further down.
1, 2, 3, go.
Right. I think that's pretty good. Alright, so start shocking him in.
Do you want to put the head?
Do we do head blocks at this point?
No.
That's the last step, right?
Okay.
So we gotta strap him in first, and then head blocks is the last step. Oh, don't pull that one. So you could start strapping the bottom side if you want.
Is the D-ring?
Not really.
Huh?
Because I also have to like wash them and stuff. So the new ones, they're kind of cheap too. That's why I don't like them. The new ones, they're like clips. I don't know, like the black cap clips. You know, the ones that go across like that. And I just don't.
So the way you sit down on them is the way you sit this way?
No, that one you just go straight across the pelvis, and then you just cross over.
It's always on your head.
Correct.
And then
Go across.
across to the shoulder.
Nice. Pelvis. And then go through that one, and then come across the shoulder again into the D-rings. So you're good. You're good. Keep this on like a meaty side. Keep pulling that. Okay. Then you're gonna cross over this way. You want to make sure this is nice and neat too. So go into this hole right here. Yep, now you're going to go across again. And then straight through the D-ring. You're also going to go through the D-ring on this one. So straight through and then back through a one. Go over. And then
Just tighten.
yep. Keep going. Yep, and then the way we lock it, you just get beat like this. So you go under, make a little loop,
Oh, okay.
and go back on the D-ring so it doesn't come loose. And then before we tighten this the chest one down, what do we need to ask the patient to do?
To breathe in.
Yep, take a deep breath, right? Take a deep breath, tighten it down, and secure it.
What do we?
So the way I do it is I'll just go under, so make a loop here, go under this, right? So you still have your loop, make another loop, and go straight through it. way you lock your reins up. It doesn't- There's many ways to do it. You don't need to do it like that. Now, you can do, yep, head wash, right? We do the last step. Yep, it's just backwards. Yeah.
And then there's the strap behind.
Now what can your partner do?
She can remove.
Yeah, she's gonna go. Now give him a little gurney.
Okay. Do we check, reassess when we're on the grid? Like when we're done with?
Correct. No. So since you guys are only 3 people, either you use 4 people or you use 2 people. Yep. The 4-man carry or 2-man carry.
On 3, ready, 1, 2, go.
All right. So then you set them down, you strap them in, start going to the hospital. What's our ongoing assessment?
Ongoing assessment?
Yeah.
That's.
Yep. Yeah. Sample, PQRC, all that good stuff.
Okay. Signs and symptoms, there's no symptoms.
Are you sure?
Well, this the spine step off, is that a symptom?
It's a sign, right?
It's a sign.
What's a symptom?
What, John is.
What he's feeling, right? What can we ask?
Are you feeling, what are you feeling?
Pain in my neck.
Okay. And then do you have any allergies?
Nope.
Any medications you're taking right now?
No.
Any important, have you felt like this before?
Yes, I felt like this in the past.
When was the last time you peed?
About 2 hours ago.
And what were you doing before this?
I was just chilling on the couch, getting up to get a glass of water, and I felt dizzy and fell.
So, that's onset. Do I still ask him?
So onset, you wanna ask if the pain came on sudden or gradual,
Okay.
right?
It came on set.
Obviously, in his case, it would be sudden.
On a scale of 1 to 10, how bad is the pain?
So
Oh,
let's go in order. Let's get that severity. Yeah, let's go in order. So provocation. What do we ask for provocation?
What? Well, like that guy just asked
So
for
it'd be
positive.
no. So that we're gonna ask if anything makes it better or worse.
Oh, okay.
Yeah. So he says no, nothing makes it better or worse.
Does the pain?
No, doesn't hit anywhere.
On a scale of 1 to 10, how bad is the pain?
About an 8.
When did this start?
Yep, about 20 minutes ago. Forgot one more. What's the cue? What's the cue?
How is the pain?
Yeah, it's a sharp pain.
Okay. So now we can
Yes. So you want to take vitals again, right? So reassess. So you're gonna reassess your vitals, right? What else are you reassessing? So if we look at our reassessment in your books, it's gonna you grab your book too. If you look at our reassessment in our books, it's gonna be everything we've already done. We're gonna just reassess it again. So we're reassessing ABCs, right? We're reassessing AVCOOP, or level of consciousness. We're reassessing helping them? Are they getting worse? Are they getting better? If they're getting worse, do I need to give them more oxygen? Do I need to change it from a nasal cannula to a mask? Is this still working? Right? Is all this spinal immobilization that we did, is it still working or is it not working? Do I need to change anything? Do I need to fix anything? And then reassessing also PQRS. So it's no longer OPQRST because we already got onset and we already got time, right? We don't need to get that again. We want to make sure during our transport, is anything changing? Is anything making it worse now? Is anything making it better? Does the pain feel different or does it still feel like that sharp pain, right? Is it is it worse now? Is it better? Is it from, you said it was an 8, is it like a 6 now or is it a 10 now? So that's what we're looking for. So in our reassessment.
The airway is clear open.
Yep.
There's no need for suction.
So you're just telling me what you're gonna reassess. When it comes to your reassessment. Yep.
Okay, so I'm reassessing these, and then I'm checking vitals,
Yep.
and my intervention work,
Okay.
and then the level of consciousness,
Okay. Cool.
and then I would do a detailed head to toe again.
Yeah. So you're reassessing your head to toe, right?
So for the final, you just
Yeah. You're just telling me what you're reassessing.
okay.
Yep. And so what do you think's going on?
Well, so yes, and spinal step off. So
Well, not step on, but tenderness, right?
Oh.
No, tenderness.
okay, I didn't feel any step off.
No, just
Oh.
tenderness.
Okay. He's feeling spinal tenderness, and his
So what are you suspecting?
spinal.
Spinal injury. Yep. That's pretty much it.
Nicely done.
Yeah, got it.